Okay, so we're going to go into the different types of therapies. We're going to get our one-page summary out, and the best way to know and learn about the different types of therapy is the different types of approaches in psychology. Okay, so we're going to start with the first one, which is psychoanalysis. And this is again based on Freudian's ideas of the unconsciousness. They deal more with like these repressed memories, and believe, that there's a struggle between the id, the superego, and the ego's trying to like just balance it. So there's different ways of getting basically to the unconscious, right? Like the unconscious is the one that these hidden desires that are basically the ones that are affecting us. So there's different methods. One of the first methods that they use is free association. And this is basically just whatever comes to mind. If a therapist is going to use this, they tend to start asking questions and go a little bit deeper as they go. And then they say eventually that the unconscious will appear. There's resistance, what they call resistance, which is basically any type of there's mental blocks. That means that there's a resistance, right? And then that's what they'll kind of like try to dive in there. They do a lot of dream analysis, specifically the latent content, right? So dream analysis, the manifest content is the one of just like what it's manifesting, which is just like what is a dream about. And then latent content is what they represent, right? And then they believe that is the unconsciousness. They have this thing called transference or transferring, which is basically what happens is that, and they say it happens naturally with this type of therapy, in which the patient transfers their emotional issues unconsciously to the therapist, right? And then that allows them to create a strong positive or negative feelings towards the therapist. So therapists have to be careful that they're not transferring, right, their emotions to the therapist, but sometimes the therapist can use that to allow them to heal whatever is in their unconsciousness. Um, there can also be a counter transference when the therapist is transferring, right, their unconscious emotional response to the patient. And this actually takes a really long time when you're doing psychoanalysis. They definitely need to be there doing it a lot more often. And there's a lot of controversy when it comes to the psychoanalysis because there's no empirical research, right? So, and it's also up to the therapist's interpretation of what the person is saying, right? And then there is a psychodynamic therapy, and it's basically this one doesn't go too much. It's the same thing about the unconsciousness, and they use the same strategies. However, they don't go into too much of like the id, the superego, and this sexual tension, none of that. All right. Okay. So then we go on to the humanistic approach. And the humanistic therapies, right, is this one is all about the self, right? Your self-image, you're kind of reaching that self-actualization. This one's definitely they're gonna help with self-awareness and self-acceptance, right? And then very important, the one that they use is what's called the client-centered therapy. Definitely one that you see very often on the test. This is Carl Rogers, a humanist that also we learned about, we learned about in motivation and personality, like that motivation, emotion, and personality. And basically, is this one self-centered therapy is that they believe that the problems, right, the troubles are coming from your real self, and trying to reach the ideal self, right? It has to do with the real self and the ideal self, that conflict. And then they focus a lot on the human potential, right? What you are capable of doing. And they definitely work on the right now, like what do you have control of? And then the therapist role is actually very, very important because they definitely need to be like very non-judgmental. They need to have the unconditional positive regard, that word again. And and this one is basically, I'm going to highlight it here, but this is where the clients, uh, they reinforce the clients have value, right? That they are, they have positive traits, that it's not just this negative um, condition, right? Or their potential, right? Like they really are focusing on that the patient is worthy, basically, right? And a kind of in a positive light. So the therapist can never be like super judgmental or make a face, right? They just need to be pretty neutral. And they also need to incorporate this idea of empathy and genuineness. Um, so from this, they definitely, and another one is active listening. It's just basically like, echoing back what the people are saying, like, oh, so is this what you mean? Or is this what you said? And allowing, it's really like the patient is the one that reaches the self-actualization, and the therapist is just there kind of like to hold your hand through it. Okay, now this one again is a little controversial because there's no really empirical research behind it. So there's, these two tend to be a little bit more in the conflict side. Then we go on to behavioristic approach or behavior therapy. And this one is going to use the principles of classical and operant conditioning principles. So again, this one, they look specifically just for behaviors. How can we change this behavior? And we'll start with the classical conditioning. And remember, classical conditioning is where we've paired a neutral stimulus with an automatic response. And so to a stimulus that creates an automatic response. Typically, fears. Fears is what a lot of this approach will be used. And so we start with the counter conditioning, and it's basically replacing some type of fear with a more relaxed response, right? Or a more positive response. So it's like a counter conditioning. So I'm going to reverse this conditioning that happened. And then there's different ways of doing that. And one of the first ones is exposure therapy. Exposure therapy can be very, very effective, but it needs to be done well, because we're tapping into something, especially fear, that can create, anxiety, panic attacks. So it needs to be well done. Somebody that knows. And so basically, they're just going to expose the person to whatever the fear is, but slowly. Okay. And then what they usually do is what's called the systematic desensitization, right? It's systematically desensitizing them from responding to the thing that they fear, right? To the stimulant. So this is something that first thing they need to do as a therapist is, okay, like, what is your fear, right? So let's say I've told you guys about the student that was like super terrified of clowns and did not like the Bobo in the Bobo in the classroom. So with a patient like that, right? Systematic desensitization is you're going to have to talk about, okay, what are your different levels of being okay with that stimulus, right? So there's some people that can't even see it in pictures, right? Like that is scary. So if it's like maybe, okay, I'm okay with you saying the word, and then but anything else, it gives me anxiety, right? Or different levels of anxiety. So then they'll slowly introduce, each little level that you the patient had said, oh, this creates anxiety, like the different levels, and they start kind of at the bottom. And then once that at that level, they're no longer responding with anxiety, then they'll move on to the next one. So maybe it's, if you can't even see a picture of the clown, maybe just saying the word, right? And then, okay, so maybe we're going to keep on talking about the clown and we could talk about it. It's going to create anxiety, but not as much, right? And then with the therapy, they're just basically, trying to reduce that. Once there's no response with that, with the saying, then maybe they move on to a picture, right? And then and the picture, will create anxiety, but again, they'll walk through it, and then eventually, the goal would be to remove the fear completely. It does take a long time, and depending on how severe the fear is, obviously, and of course, thanks to technology, they have also like virtual reality exposure therapy, which has been very effective, especially for behaviors like or fears of like airplanes, right? So it's, if you're doing exposure therapy and using a systematic desensitization, you cannot wait till they get on the plane to see if it works, right? Like it needs to, like maybe there's a virtual simulator that can do that and in a safe environment. And then there's called the implosion therapy or intensive exposure therapy. Another word could be flooding. And that one is basically can be very, very dangerous if not, definitely checking the anxiety hierarchy. But it's basically that just like if they're afraid of, let's say, spiders, like they will put them in a room with a spider on them. So it's like very, very intense. Lots of times they don't use this, but it can be done, okay, and definitely in a safe environment. And then there's aversion conditioning. So this is when they want to basically substitute a negative response with a more positive one that won't be as harmful. So usually they'll use aversion therapy for things like maybe even food. It's a little tricky, but typically it's done for like bad habits like alcohol, if they drink alcohol or cigarettes. They'll use aversion therapy in which they'll give them like if they drink alcohol, they'll give them something really bad in the alcohol, and then they get sick, and so they associate that sickness with the alcohol, so then they won't drink anymore. They've used this also in like for people that would smoke cigarettes. They will like give them something like a drop of something on the cigarette, and then they'll get sick, and then basically avert them. It's like an averting them away from this behavior. And then we have operant conditioning application, and this is about rewards and punishment, right? So reinforcers and punishment. So reinforcers is they're going to look at so what they work on is what's called behavior modification, right? Modifying a behavior. And they're going to basically try to change or try to increase the desired behavior. So if I'm doing that, if I want to increase a behavior to the desired behavior, I'm going to use reinforcers, right? I could use positive reinforcers or I could use a negative reinforcer. Typically, positive reinforcers are your most effective, such as a token economy. A token economy is when you get like a sticker or a token or a coupon. It could be anything that has typically no value. And then they give that to the patient when they're doing something well or the desired behavior, right? And then after a couple, depending on how many, or whatever the rule is, then they're going to get those tokens and then they're going to exchange it for something of value that the patient wanted. There's also punishment that they can use. Obviously, this is to decrease behavior. And one of them is that they've used is the what's this called? The like bedwetters, and when the bed gets wet, like it come like an alarm goes off, and which then they associate this alarm with scary. It's kind of a little bit like classical conditioning, but it's definitely a punishment for the people, the bedwetters. Um, but obviously, punishment is not as effective as the reinforcer. Okay. And so that's basically for behavioral therapy. It's actually really good for people with like ADHD. They use a lot of behavior therapy with children with autism, and anxiety can also be one that they work on as well. Okay, then we'll go into cognitive therapy. Cognitive therapy has to do with your thinking. So here, they're going to focus on teaching new ways for the to the patient, new ways of thinking, right? Just more thinking that's going to help them. Okay, here I can't even talk. All right, so the first one that you need to know is Aaron Beck, and he is the one that started this whole cognitive therapy. And it's basically that you gently question the patient, and allow the patient to essentially become aware of their irrational thinking, and then to kind of replace it with, a thought that obviously is going to help them, with their problems. Under here, you also have the stress inoculation training, which is basically it's like a way of teaching you how to rethink in stressful situations. So a lot of these trainings, like firefighters, police officers, definitely they need to work on this because they need to respond in a certain way when they are in a stressful situation. Okay, then we have Albert Ellis, and he is going to have the rational, emotive, a behavior therapy. Okay, so there is a B in there usually. Might look like this, who knows? Okay, but this one is actually really confrontational. They're like in your face, kind of showing you like the illogical thoughts, like really saying, like, really, like, probably not like that, but a little bit more sensitive, but definitely in your face, like, this is a problem, let's face it. So it's very, very confrontational. Some people like that, some do not. So it just kind of depends. And then the last one is, it's not here. Oh, yes, it is. So it's cognitive behavioral therapy, which is basically CBT. It is the most common therapy used currently. And it's basically a combination of let's work on our thoughts and then let's work on our behavior. This is really good for people with like anxiety, mood disorders, and even OCD, right? So this is a very effective strategy to work because, as you guys know, our thoughts definitely affect our behavior and vice versa. Okay? And then we're going to go into the biomedical therapy. And biomedical therapy is obviously the biological approach to therapy, and there's distinct, right, disorders that definitely need the medication to function, right? And of course, they always highly recommend, and the most effective, like biomedical therapy is effective when you take in like the medicine, as well as the psychological therapy, right? Like either be it cognitive, behavioral, analytic, any of the other ones, but definitely very, very effective when they're both combined, not just like, oh, okay, like let me just give you medicine and then you're good, right? It's like diabetes. You take you get, if you have diabetes, like type 2 diabetes, and the doctor's like, here, get some medicine to lower your sugar or whatever to fix this problem. But it's the medicine alone is not going to do that. You have to also change and do different, different lifestyles. So same thing with psychological disorder. So the first one is going to be the antipsychotic medications. And this is usually, this is an antagonist, right? It plays, like it's similar to a neurotransmitter. And essentially what it is, this one is to treat usually like schizophrenia, right? So these are people with have too much dopamine. So you want to reduce it, the dopamine, so it goes into the receptor sites basically, and then it blocks it. Okay, then we have anti-anxiety medications, and this is basically to uh, depress your central nervous system, right? Activity. So you want to reduce the central nervous system. This is typically with people with anxiety disorders, OCD, PTSD, right? And then we have antidepressants. Sorry, excuse me. Antidepressants are your medication that is usually with people with mood. It could also be anxiety, OCD, right? They're kind of, combined together. And this is where you'll see the SSRIs, which is that selective serotonin reuptake inhibitor. And it works something along these lines. Let me just do this. And so what it does is it does not allow for reuptake to happen. So then the receptor cells are basically taking in all of the serotonin that gets released, right? So it allows for more serotonin to change to help with mood, basically. Okay, and then we have our mood stabilizers, and this one is usually used with bipolar, and yeah, this is typically because it controls the manic episodes. And then there are different ways of also, if you don't want medication, there is brain stimulations, right? They have what's called the electroconvulsion therapy, the ECT. And this is typically used for people that are very extremely depressed. And usually they'll do like medication, right? Like therapy, like the hierarchy of severity is like therapy, like talk therapy, then medication, and then these brain stimulation. And then this would be just, they do, like they relax you, you're basically getting like electrical currents in the brain. And then for about like 30 minutes, they have to do this at least 3 times a week for 2 to 4 weeks, and definitely shows some improvement. But of course, you're messing with the brain, and this is going to actually can affect your memory loss. But definitely very effective in treating like really severe cases of depression. Then there's the magnetic stimulation. Magnetic stimulation is basically that they are sending pulses of magnetic energy to the brain. They're not 100% sure of how this works, but it basically just stimulates, or it can suppress brain activity. If there's too much of something, they tend to then can use the magnetic one. And last but not least, which is the last one of the hierarchy of severity, would be a lobotomy. And this is basically where they're going to disconnect the nerves from the frontal lobe to the emotion controlling center of your inner brain. And then this is basically to calm uncontrollable emotions. Again, tends to be kind of like the last thing, and really not really used today. So we are going to go quickly on group family therapy. So there are what's called group therapy. So this is all like individual, right? These that we covered. Then we're going to go into group therapy. And group therapy is basically like you're with a bunch of people that are, similar symptoms or diagnosis, and then, they kind of collaborate and give each other feedback. It's kind of like I'm on the same boat. It becomes like you're in group, right? Which can be a positive and a negative, right? A positive is obviously we're helping each other. If especially people that are progressing in their recovery, and usually this is really good. Like AA, for Alcoholic Anonymous, is really effective for some. There's also others for like eating disorders or families, that Alliance for Anonymous, like family members that their parents or family members that are just alcoholics, and they get to talk to people the same. It could also be a negative in which you get your, and we just talked about that, or I just talked about it in social psychology, where you get a, oh my goodness, what is that called? That you're in, when you're in with the in group, oh, group polarization, that's what it is. That um if you get a group of people that are like on the negative side of their recovery or the disorder, then a lot of people can also go kind of on, to that side, right? Like the more negative. That's why it's important to have a therapist there, in which kind of guides the group therapy. Because if you live it like online, if when you have those people, like let's say there was a time, and probably is still there, that people with an eating disorder, they would start a page, and then they would, people would join, right, thinking it's a support group, but eventually it was just creating like a group polarization to continue in this sense of the eating disorder and continue those behaviors. So it kind of became like counterproductive, in which here I am for support, but it's fueling the disorder. Another type of group therapy per se is going to be family therapy. And this is when they invite the family in with the therapist and the patient, and then they discuss, their relationship dynamic, how to kind of build a healthier relationship with one another. There's the self-help group that tends to just be like a common goal of what they want to do for healing, and then there is the couple or marriage counseling, in which the couple comes together and with a therapist and basically try to create, better communication, how to deal with conflict with one another. So it can be very effective if obviously with good therapists and the right fit for you. Culture and gender definitely also play a role in effectiveness of therapy, because you want to have somebody that can relate, right? That understands your culture and your customs, and then some that need to, like, even the gender, right? Like how females or males, their roles in society and so forth, okay? It does not mean that just because you are, let's say, a male and you want to go see, you have to go see a male therapist. That doesn't necessarily work. There can be, you could be a female and go to a male therapist, right? Like, so I had a male therapist and I really, really enjoyed his approach. Totally different aspect and look, which did definitely help when I was going with him. So it just depends really what works, what fits. It's kind of like an interview. It's a relationship you have with a therapist. Very important that you can trust them, that they're giving you sound tools to deal with the disorder. So definitely, it's a trial and error of getting the right one for you. So don't think that just if you do ever go to therapy or hear other people saying like, "Oh, I went to one, but totally sucked. This doesn't work." Da da da. I had a friend like that. She went to one, and she's like, "Therapy is not for me." And I'm like, "Yeah, no, that therapist was not for you, but therapy is definitely can be very, very effective. There's tons of research out there that shows." And one of the most effective types of therapy, and it's not in here, is what would be called the eclectic approach or eclectic therapy, which is basically combining different approaches. So, like cognitive behavioral therapy is an eclectic therapy that, as I said prior, is very, very effective because they're combining. So it just depends. A good therapist will definitely use all kinds. So, and that's basically it. So definitely, um, there is basically we just talked about all of the therapies, and guys, big push with therapy because it is important to talk, right? And learn tools. So, and the research backs it up. All right, guys, have an awesome day, and I'll see you soon.